The CDC is expected to release new guidance when it comes to people who have already been vaccinated. Sources tell CBS News that it will recommend that everyone keep wearing masks in public and social distance. The guidance is also expected to say that it's safe to gather in small groups with people who have also been vaccinated. Justin Gill joins us now from Bothell, Washington. He's an urgent care nurse practitioner. So, as an urgent care nurse practitioner, you are in the trenches. Yes, doctors do a lot, but nurse practitioners, man, you guys really sort of get your hands, you really do get your hands dirty. So it's good to have you here. We are seeing states like Texas and Mississippi already lifting restrictions. Mask mandate gone. The governor in Texas encouraging business to operate at 100% capacity. The president has warned that this is a bad idea. Experts say this will set us back. What is your take on this?
I'd have to agree with that assessment. This is one of those situations where I think we've been here a couple of times before. When it comes to the use of masks, social distancing, that's been our most effective tool for the past year. We've had spikes and we've had dips in cases, but every time that we seem to have this decrease or plateau of cases in the country, we see this rollback of restrictions. And right after that, we see a much higher spike. And this is even more worrisome with some of the new variants that are going around that may be a little bit more transmissible than the previous strains of COVID-19. So, I think common sense really needs to be used here. And I think that the president's guidance that we still continue with these restrictions is extremely important. Folks that I see over in the clinic that I work in urgent care, they still express concerns about this. They don't necessarily know if it's going to be safe that their kids go back to school, how long this pandemic is really going to go on. And we're really extending the pandemic, or at least allowing for it to potentially expand if we roll back these restrictions too soon. And we live in a state where people communicate, or they transport over state lines. So it's something that, what one state does, particularly a large state, can impact all the other states around them.
So to Anne-Marie's point, the CDC has noticed a slight uptick in new COVID-19 cases. It says that the current 7-day average of new cases is just over 66,000. That's a 3.5% increase from the previous week. The issue, I think, for a lot of people with the lifting of these mask mandates is not for the people who live, in an area of town or who don't have to interact with a lot of people on a given basis, because a lot of, companies are still having their employees working from home. What the risk, I guess, and the question I'm asking you is, what risk does it put people who are bus drivers, people who work at grocery stores, people who work at pharmacies, people who work at restaurants and bars who have to go into work because they need a paycheck because they got to pay their rent, right? But now no one has to wear a mask if they come into a coffee shop. No one has to wear a mask if they go into a supermarket, or if they go into a grocery store, or if they get on a bus or any kind of public transportation, a taxi. So the risk is for a certain group of people that have been disproportionately affected by COVID-19. The risk for them has just gone up.
Absolutely, and I can speak to this as somebody that's worked in healthcare and treated and counseled patients with COVID-19 or suspected COVID-19. And I think that there's some level of assumed risk that many of us have going into these positions, so whether it's in healthcare and grocery stores, or in any kind of public position. And it's one of those things that all of these workers have been the backbone of our society over this past year throughout this pandemic. And we need to look at the risk that is posed to them specifically. Another key point about this is that when you have these mask mandates rolled back, and you have folks in public settings that aren't necessarily wearing masks and have the potential to spread COVID-19, every time that COVID-19 spreads, as Dr. Fauci has mentioned, it provides another opportunity for more variants to emerge. So, as we're seeing a slight dip and now plateau, and in some cases uptick in cases and vaccines that are out, we really do not want any new variants to emerge that can pose a threat to the vaccine and the effectiveness of the vaccine.
I think that's a good point, because I think, often people, it's hard sometimes for people to believe the numbers if in their own personal circles of friends and people they know, they're not seeing the virus, which you could be lucky. You could be in an environment where there's not a lot of infection. But that doesn't mean that any one of those people in your environment can't go somewhere else where the infection rate is higher, contract it, and bring it back. And, suddenly you're part of those numbers as well. Unfortunately, for so many of us, we have to actually experience it to actually believe it. But I want to ask you about some of the latest studies that we have been looking at. Of course, everyone's trying to figure out why some people are more susceptible to this virus than others, why some people get gravely ill and other people don't even realize they have it. There's a new study that suggests people who have obesity should be prioritized for the vaccinations. The report is by the World Obesity Federation, and it found that 88% of deaths from the virus were in countries where more than half of the population classified as overweight. I'm not sure about the exact statistics, but I think the U.S. might actually sort of be in that, if not close. What's your take on this? How concerning is this? Should being very overweight kind of put you in a category that puts you a little closer to the top of the line for the vaccine?
Absolutely, and I'm glad that this point is being brought up, because it really represents that other healthcare issues or other health problems directly relate to COVID-19, and COVID-19 doesn't exist as one single problem. Obesity has been a long-standing issue in the United States for decades, and it's a growing problem. We do know that individuals that have obesity or are categorized as obese do have a higher risk of cardiovascular disease, type 2 diabetes. In addition to that, looking at other issues like sleep apnea and other breathing difficulties, all of those factors contribute to risk factors with COVID-19 and the risk of developing a worsening condition. So, it really represents the fact that moving forward, we need to look at all different aspects of health, whether it's healthy food access, whether it is access to preventative medical care, or access to a safe environment to go for walks and exercise. All of those pieces directly contribute to health and outcomes, whether it's COVID-19 and moving forward.
All right, Justin Gill, my friend, thank you very much. Appreciate it.
Thank you.